Okay, so first of all, I want to welcome everyone and thank you for taking time out of your busy days to join us. This has been an exceptional federal election, probably one of the most important in recent memory. So we really wanted to bring a group of exceptional political minds to walk you through what just happened, and I think more importantly, what it means for you and your organization. Now, normally I would give you a more thorough background of our panelists, but with such a large group, I will summarize and provide a few highlights, but you can find more information on the Santis website. But each of these individuals has decades of experience working in government, including both in federal and provincial governments. And more importantly for this webinar, they all have first-hand experience in the transition of power. So we have Dave Penner, who is Senior Director at Santis, and he has 30 plus years in politics and public affairs, including 20 years on the Hill and as Director of Appointments to Prime Minister Stephen Harper. We have Jill Pilgrim, who is our Senior Consultant, who has 10 years in federal government advising 4 ministers, including most recently as Director of Policy to the Federal Health Minister. So I'm sure there's many of you on this webinar familiar with her. We have Saad Rafi, who is our Senior Advisor, and he was former Deputy Minister in Ontario, including in both health and long-term care, and also was Head of Policy in the Cabinet Office and through a comprehensive transition response for the Harris government's second term. And then, of course, we have Marcel Saunier, who is our Senior Advisor. He was previously Associate ADM of the Strategic Policy at Health Canada, and was deeply involved in transition-related work around federal elections in 2008, 11, 15, and 19. And he also has worked at the center of government, including the Privy Council Office, the Prime Minister's Office, and the Department of Finance. And I am Danielle Fleeler. I am Manager of Federal Affairs at Santis. Some of you may already know me, but for those who do not, I have worked in health and advocacy for over a decade. And I am super pleased to be moderating this webinar for you today. So just some quick housekeeping. We will be taking your questions over the course of the webinar, and those can be submitted at the bottom using the Q&A function. Our team will be reviewing them, and we have allocated some time towards the end of the webinar to address some of them. We will also circulate a recording of the webinar and the slide deck at the end of the presentation. And we will also have a survey shared after the webinar where we would really appreciate your feedback on how we can improve these webinars for you moving forward. So please try and fill that out if you can. And then quickly, as we have a lot to cover today, next slide, Haley. If you are not familiar with Santis Health, we are a proudly Canadian company, and our firm has a footprint all across Canada and works exclusively in the health and life sciences sector. So we offer integrated support through our government affairs, strategy and management consulting and communications team. And behind the scenes right now, we have Haley, who you might hear us reference from time to time, supporting this webinar. So thank you, Haley. And we also have specialized expertise in life sciences and digital health. So moving right into it, the election results. So the Liberals, I think everyone knows at this point, have won a minority, just 3 seats shy of a majority. The Liberals and Conservatives significantly increased their vote shares at the expense of other parties, but primarily at the expense of the NDP. And interestingly, these did not all go directly to the Liberals, but the Conservatives actually did gain from their decline as well. But I think one of the biggest takeaways is that while Canadians all want to see change, we are certainly a divided country when it comes to who that should be. It was neither a concise victory for the Liberals nor a resounding defeat for the Conservatives. And the Bloc and NDP, while I think are certainly in no position to go back to the polls, but with no full mandate for the Liberals, it's going to take a pretty strategic and savvy government to get their policies through, because they are now going to be up against a more powerful, confident, and I would say likely very frustrated opposition party. So I'm going to hand it over to Dave to walk us through the details of the last few weeks.
Good. Well, thanks very much, Danielle. So we'll look at the impact on the campaign trail. Political pundits always try to guess what the ballot box question is going to be. And rarely do they ever guess this right until now. Everybody knows President Trump's 51st state message prior to the start of the election was said to become the ballot box question. It did become the focal point throughout the campaign, and in fact, it was the ballot box question. The Conservatives, as you probably know, stayed on Axe the Tax, Carbon Tax Carney, and Canada is Broken message. They stayed on it probably too long, and that cost them dearly. But something that's become probably one of the biggest stories in the campaign, or was the biggest story in the campaign, was the NDP. Some support from the NDP went to the Liberals directly to stop Pierre in some ridings, and in fact, a lot of ridings. Boomers, the 55+ crowd, and women flocked to Mark Carney. Some traditional union support that was traditionally with the NDP, oddly enough, went to the Conservatives. And some of you may have seen that Pierre Poilievre and the Conservatives kept on pushing out union messages and letters of support. So former strongholds like Windsor and London went to the Conservatives. Jagmeet Singh, as some of you may know, failed to connect with many of the traditional NDP voters and in fact lost his own seat in Burnaby, BC. But the message of change helped both the Liberals and the Conservatives. Mark Carney represented change for the Liberals, even though he was a key part of the government that had been around for 10 years. Pierre Poilievre and the Conservatives represented change to some voters who had been frustrated with the Liberals for the last 10 years. And I think that, as Danielle alluded to earlier, the results are clear. And I think that you can see from that, that's why the whole change narrative played for both Conservatives and Liberals. Going on to the next slide, I want to look at the implications for the opposition parties, and Jill and I are going to share this a little bit, but let's first start with the Conservatives. So as you know, Pierre Poilievre lost his seat in Carleton, which is a Ottawa area riding, and now he's looking to constituents in an Alberta seat called Battle River Crowfoot. That's the riding of CPC MP Damien Couric, and he offered to step down from that riding, a riding that he's actually held since 2019. Mark Carney has said he's going to allow a by-election there as soon as possible. This is very interesting because prime ministers usually wait the entire 11 months to call any by-election. So that's a huge change from what is normally done. The Conservative caucus, which actually is meeting probably right as this webinar is taking place, they follow something called the Reform Act. So in that act, and that's governed by their caucus, 20% of that caucus could trigger a leadership review. Something like that would be obviously very messy for Mr. Poilievre. While this could happen, from what we know, what we read through tweets and everything else, the caucus is quite supportive of their leader. However, behind closed doors will be a different factor completely. There will likely be some honest and constructive discussion about the advisory team. And even as we were about to go on this call, there's been some reports that Jenny Byrne, who was the campaign manager and has been a key player in Poilievre's office, is going to be a topic of discussion. But one thing is for sure, in all of this, Pierre Poilievre, if he stays on as leader, he will face a mandatory leadership review in February or March of next year at the CPC convention, which actually is going to be held here in Ottawa. I'm just going to move quickly to the Bloc Québécois. Obviously, no party wants to lose seats. Losing seats was not something that the Bloc had expected, especially since Liberal leader Mark Carney had mediocre French skills, and they thought that they could capitalize on that, which of course they didn't. They are now down to 23 MPs, and that's 12 less than they had before the election. And interestingly enough, all but one of those seats went to the Liberals. So with 23 MPs, the Bloc are going to have a fair amount of airtime both in the daily question period and also will have a pretty key role in the parliamentary committees. And that's something that Santis is going to be following very closely. With respect to propping up the Liberals, Yves-François Blanchet, the Bloc leader, has indicated publicly that he is going to keep the Liberals in power for at least 1 year. So with that, I think that we can be assured that Mark Carney and the Liberals will be in power for at least the next year. I'm going to turn it over to Jill, and she'll give us some input on what happened with the NDP.
Absolutely. So similar to the Conservatives, the NDP leader Jagmeet Singh also lost his seat in this year's election. A key difference, however, is that he also resigned as leader of the NDP, meaning that an election for a new leader will be required. The party did announce just yesterday that Don Davies will be the interim leader in the meantime. As the NDP has lost official party status, they have lost access to additional House of Commons funding resources for research and additional staff. They've also lost their ability to participate in parliamentary committees and to speak as often in the House of Commons. While having 7 seats does give the NDP the potential to prop up the Liberals and hold the balance of power, Prime Minister Carney did state in his presser last week that he does not intend to strike a formal supply and confidence deal like the previous Liberal government did. A dynamic that will be interesting to watch will be how the Liberals adjust their committee strategy with the new reality of no NDP support in the committee atmosphere, and likely the need to court block support in order for committee work to proceed. Moving on to the Liberal Party election platform. The platform this year saw a mix of commitments that balanced between, firstly, setting out Mark Carney's strengths and priorities as leader. Secondly, adopting and adapting items that the Conservative Party focused heavily on to try and win back some of that vote. And thirdly, delivering on key items that the government must move on, whether for national security or due to high interest from the electorate. Not surprisingly, the platform was heavily focused on the economy, tariff and counter-tariff measures, including an estimated $20 billion in revenue from counter-tariffs on the US incorporated into the Liberals' fiscal plan. This angle is well aligned with Carney's economic background and likely signals where his priorities will lie moving forward. Areas in the platform where there was alignment on some level, even just on theme, with the Conservative Party included things like tax breaks, housing, immigration, and overall affordability. Investments in infrastructure-related initiatives, be it trade corridors, digital infrastructure, high-speed rail, or even health infrastructure, was another commonality here. Lastly, there were some key areas of commitment that stem from a simple need for continued government action and focus, such as national defense, energy and climate, and of course, health, which we will now move into specifically. Health has commonly been amongst the top issues for the electorate across Canada. Even so, as we know, federal platforms are usually quite limited when it comes to health commitments, as so much of system delivery falls to provincial and territorial jurisdiction. With that said, the Liberal platform this year did include quite robust health and life sciences commitments. Some of these were holdovers from the previous Liberal government, such as continuing the Canadian Dental Care Plan. In fact, we've already seen an announcement from the new government stating that eligibility for the CDCP will be expanded to qualifying adults between the ages of 18 and 54 by May 29th of this year. There was also a commitment to, quote, protect pharmacare, which has been indicated by the Prime Minister to mean that he aims to finalize deals with the remaining provinces and territories, but that there's no intention at this time to expand coverage beyond diabetes and contraception. It's important to note here as well that agreements have also been signed with all provinces and territories on drugs for rare diseases, and these will continue at least for the duration of the current agreements. One additional holdover that we've seen is the finalization of the creation of a capstone organization to modernize Canada's science and research ecosystem. Beyond these holdover items, the Liberal platform largely focused their health-specific commitments on 3 key areas. Firstly, our commitments targeted at improving access to care. Many of these pieces are aligned with the work of PTs and the previous Liberal government, largely in line with health human resources pieces, including streamlined labor mobility and more medical school and residency seats. However, it is noticeable that Carney's Liberals also included in this bucket investments to help construct and renovate community health infrastructure and funds to help family physicians open new practices. These are not the typical investments into health delivery that you see from the federal government. So this will be a very interesting space to watch, primarily in how they operationalize these in coordination and likely the need to partner with the provinces and territories. Secondly, the Liberals outlined a number of commitments aimed at improving mental health and substance use care across the country. These pieces are well aligned with the priorities of the previous Liberal government and are primarily increased or renewed investments in pre-existing programming, such as the Youth Mental Health Fund and the Emergency Treatment Fund. Lastly, the platform portioned out commitments aimed at modernizing Canada's public health care system. This included a pledge to, quote, cut red tape to reduce wait times for patients to have access to medications. This is commonly known or referred to as time to list. It is worth noting that there was no funding tied to this measure in the platform, which may limit the government's ability to actually deliver. Premier Ford also wrote to Prime Minister Carney just yesterday with his list of priorities in working with the federal government during this session, and actually noted speeding up approvals for life-saving medications as one of his key priorities. There was also a commitment to table legislation to enable patients to access their health data more easily, a nod to the previous government's Bill C-72, or the Connected Care for Canadians Act, which could potentially be retabled as it was, or perhaps may undergo a review by the new minister before tabling. Two areas here where there is demonstrated increased ambition from the Carney Liberals include significant investments in incentive programs for physicians to adopt digital tools to help reduce administrative burden, and through the launch of a task force for public healthcare innovation to invest and scale up Made in Canada public healthcare solutions. Beyond these health system related commitments, the platform also included several key items related to science and research, which are closely tied to the larger platform theme of investing in Canada and growing our own economy. The Liberals seem keen to capitalize on the funding cuts being made to research in the US and aim to draw new talent to the Canadian research ecosystem through a new initiative they've coined the Canadian Sovereignty and Resilience Research Fund. In an effort to drive Canadian investment into research and development and boost the economy within the country, they've also pledged to increase tax incentive programs for Canadian companies, as well as to make investments into strategic industries such as biomanufacturing. The Liberal platform also featured commitments to increase research and data collection in key areas of women's health and to establish a new IVF program, demonstrating a continued government focus on women's health and wellness. Something else to keep in mind, particularly on the drugs and medical devices front, is that while there were pieces not outlined in the platform, there are various things that have already been proceeding within government that will be worth watching. For example, the PCPA has a new CEO in place. Canada's Drug Agency has a new strategic plan that they will need to implement. And the PMPRB has new guidelines that are expected to be released in the coming months. Something else that was not in the platform that will be worth keeping a close eye on is the future of the Health Emergency Readiness Canada, or HERC, as it's more commonly known. And lastly, with Health Canada already facing a reduced workforce as a department, something they will have to reckon with is how to deliver on all of these commitments, as well as continuing to deliver on the work they've already had flowing. The commitments around time to list are particularly interesting to watch, with HPFB already facing some delays in processing. Yeah, I think that's it for that slide. Moving on to the timeline. The big question now, of course, is what comes next. We have seen relatively swift action from the Prime Minister Carney on having key meetings to kickstart his agenda. He had an early meeting with Alberta Premier Danielle Smith to try and curb any separatist tensions there. And of course, he is meeting with President Trump in Washington, I believe, as we speak. In his presser last week, the Prime Minister also announced that he would be swearing in his new cabinet on May 12th. That is this coming Monday, and that the House of Commons would return on May 26th. He also indicated that King Charles would be visiting Canada on May 26th and 27th, and that he would personally be presenting the speech from the throne on May 27th in Ottawa. The last scheduled sitting day for the House is on June 20th. We also know that there will be a G7 finance ministers meeting from May 20th to 22nd and a G7 summit in Alberta from June 15th to 17th. The Trudeau government had not been planning on having a G7 health ministers meeting, and we have not seen indications that this will change with Prime Minister Carney, but that of course will be something that Santis will be keeping a really close eye on. Beyond these firmly announced dates, however, there are a number of other key government milestones where there remain some question marks, particularly as we are in a minority government scenario. For instance, there will need to be a budget. However, whether there will be a formal pre-budget process remains to be seen. It is also expected, but not yet confirmed, that this first budget will be quite slim and focused on key deliverables related to tariff response and the economy, from either the platform or pre-election commitments. Perhaps the bigger mystery will be the timelines on striking parliamentary committees and the naming of opposition critics. This relies heavily on negotiations and agreements between key participating parties. And in a minority scenario where there's no supply and confidence deal, finalizing the makeup and membership of committees could take some time. And lastly, the question of mandate letters. There's no set timeline on the release of ministerial mandate letters, and in fact, no firm rule requiring that the government release them publicly. Even with the Trudeau government, who did release them, it often took weeks, if not months, for them to be published. It is possible that mandate letters, and therefore a firm understanding on the direction of the government, may not be available until the fall session. Underlying all these questions around timelines and critical milestones is, of course, a transition process for elected officials and their staff from the campaign trail and into government. I'll now turn it back to Danielle to help moderate an exciting roundtable that will outline what this process looks like from the inside.
Thank you, Jill, for that perfect segue. Okay, so we are going to put the slides down now and have a bit more of an informal chat about what transition looks like with our experts here. So starting with Dave, can you walk us through the timeline of what typically happens between election night and the swearing in of a new cabinet and staffing of those ministers? So what are the key decisions that are being taken at this moment, and any other insights that you might have?
Good. Thanks, Danielle. So I'm going to go a little bit before election night and note that there's transition teams. Both the Conservatives and the Liberals would have had transition teams in place for the last couple of months. Just in case either the Conservatives or the Liberals would have won, they have people who are ready to action on many of the things that the government is looking to do. Obviously, Mark Carney was the Prime Minister, albeit briefly, prior to the election call. So there's some things that would have already been in place following this most recent election. Probably one of the most difficult things that any Prime Minister has to do is put together a cabinet. And most people think it's just, you just go and put 30 of the brightest people in the room. And that's not always the case. And I'm not trying to say that the ministers aren't bright. They all are bright, but it's where they come from and how they're put together. So the key thing that to look for is size. Before the election, Prime Minister Carney's cabinet was 24 members. We have heard and been reported in the media that it's going to be probably closer to 30. He's also mentioned that he is going to have gender parity, something that Prime Minister Trudeau brought in 2015. Prime Minister Carney's previous cabinet did not have that, but we think that that's going to be a key thing going forward. The one thing, I mean, I know in real estate they often say this: location, location, location. That is how cabinets are put together, and where are they coming from? And we have 5 regions in the country: Atlantic, Quebec, Ontario, Prairies in the West. Does he build a cabinet around that, or does he go by having at least one member from every province? He has MPs from all 10 provinces and 2 of the 3 territories. So we'll be looking very closely to see how that gets put together. Something to look at, and just because a department had a certain name or certain structure prior to the election does not mean that that's going to be the exact same going forward. And so the creation and the names of departments is something that we'll be looking at very closely. So we always talk about how you get rewarded in cabinet. You're going to get rewarded by cabinet, or also sometimes parliamentary secretaries and even chairs of committees. So when you look at Mark Carney, his caucus is 169 members large. He's going to have to make sure that you know, the majority of them are happy with their roles and that they're, you know, doing something. So committee structures, committee chairs, a variety of things that a prime minister has at his disposal to help with that. The Prime Minister's office has a staff complement of approximately 100 staff. So one of the key priorities, Marco Mendocino, former minister and under Prime Minister Trudeau, is his chief of staff at the time being. One of Marco's first and key jobs is to staff that PMO. Probably four key areas. One would be issues management. The next one would be the appointments. During Prime Minister Harper's time, I was his director of appointments, and that became a job of filling all of the roles and that our government is responsible for. Probably one that we'll be watching out very closely is who the U.S. ambassador will be, and I think that's something that is going to be pretty important for Prime Minister Carney to look at and to see who that gets named. Communications, obviously a big communications job, big roles to fill in that PMO. And the last is something that people don't always talk about is tour. And the tour office in the PMO is pretty big. As Jill mentioned, that Prime Minister Carney is down in Washington right now. He'll have a tour team to make sure that all that gets put into place. So that's a little bit of inside baseball, but gives you an idea. The PMO in most cases has a bit of a hand in who will staff the ministerial offices. And let's say there's 30 ministers. Every office has between 10 and 20, let's say, staff who are in there, who are exempt staff, political staff. The PMO has a hand in that. In some cases, they'll have a hand in who gets to be the chief of staff. And sometimes it's a campaign worker, somebody who's loyal to the prime minister gets put into a minister's office and helps run that. Let's give you a little bit of quick snapshot. When I was with Prime Minister Harper, we were day one, but we were there after 13 odd years of Liberals, and day one in Harper's PMO will be much different than day one in Mark Carney's PMO, and but very interesting days ahead. So I'll turn it back to Danielle.
Thanks, Dave. I love the inside baseball. That's what we're here for. Okay, so moving over to you, Marcel, to talk about, I think, another very important group right now. So what are some of the key responsibilities of the civil service in the days immediately following a federal election?
Yeah, well, I mean, in the public service, it's really an exciting time, you know, between the election and the appointment of cabinet and then beyond that. I'd separate the group between sort of those working at the center of government and those working in line departments. And at the center, in particular, the Privy Council office, which is really the nerve center for the government as a whole, and the clerk and secretary to cabinet is the ringleader of all of this. And there are a number of functions that PCO provides during this critical time, a couple of weeks or so. You know, they're briefing the prime minister on a whole manner of files, economic, foreign policy, social policy. So lots of briefings coming through the system. There's, as Dave alluded to, big machinery of government decisions to be taken around appointing cabinet, the mandate letters, changes to departmental mandates, the structure of cabinet and cabinet committees. Those are all big decisions that need to be taken, and PCO has a secretariat to support the PM in making those calls. There's also priority setting, and that is really critical in the early days of the government. We have a speech from the throne that is coming up in late May. So helping the PM and his team in the PMO land on what they want to have in the speech from the throne. How much detail? Is it going to be high level? Is it going to focus on the main sort of economic and trade issues that the government has on its hands? How much further afield will it go beyond those core priorities? So those are some of the things they need to sort through very quickly. There's also the government's legislative agenda. You know, what's going to be the pecking order of the different pieces of legislation that will be put before the House. As you can imagine, there are lots of pieces of legislation, as was mentioned earlier, you know, some in the health sector that died on the order paper that may be brought back. Carney has talked about, passing legislation or introducing legislation by July the 1st on free trade across Canada. So lots to be done there. There's also appointments, and here we're talking about senior personnel, deputies, and so on that may need to be appointed, ambassadors, senators, heads of crown corporations, other governor and council appointments. And lastly, for the PCO, I think it's just basically the logistics of helping the PM and the PMO kind of get up and running really quickly. PM's already traveling. PMO is being recruited and needs to have office space and phones and everything that they need to function efficiently. So those are the sorts of things that PCO is responsible for. Now, if you're in the line department, the situation is somewhat different because you have a little bit of a honeymoon time here between the election and the appointment of the new minister. And you need to use that time really wisely. So the line departments have been building up their briefing binders based on what was in the platforms of the different parties, based on analysis that they had done internally on what the key issues facing the country in each of their sectors are, what some of the early decisions the government needs to take on some of the most pressing issues. So they got their transition packages in pretty good shape, but now they know which party won, which platform they need to kind of take into account. They can sharpen that advice. And we're talking about multiple decks across many different issues in any department's mandate that need to be fine-tuned and the rest of the transition package prepared so that it's ready to hit the ground when the new minister is appointed. They need to prepare a briefing schedule. Of course, they'll wait till the new minister's in and his team is there to kind of put that in place. And then also from the health department or the line department perspective is logistic support for the new minister and the minister's office, making sure that they have, the office space, the infrastructure, the communications support needed so that they can do their job well. So those are the key kind of pieces that need to come in place during this critical time, Danielle.
Thanks, Marcel. I think between you and Dave, we know there is a lot happening in Ottawa right now, to say the least. Okay, so going on that sort of thread of the work between the PMO and the PCO, which for those of you who don't know is the Privy Council office. Saad, so how will political staff and their ministers in the health minister's office collaborate with the prime minister's office? And then I think separately it would be important to know, how does the PMO also collaborate with the Privy Council office? Because it sounds like those three are sort of really important for, the people watching this webinar. And so how do they all kind of work together right now?
Sure, thanks, Danielle. Excuse me, if I might just take a little bit of a liberty. For me, this starts with the Prime Minister's press conference of last week. He laid out a very activist agenda. Jill has talked about some of that already. I won't repeat that. But to me, that's a signal to a whole score of groups. So, for example, the public service is watching, or they better be, because the agenda is being set for them in that presser. You can imagine that the clerk has either gathered deputies or certainly has given messages to deputies as to what are some of the priorities. Jill did a nice job laying out what's the timetable of activities that are already in the schedule that must be adhered to, from G7 to perhaps as importantly the meeting the Prime Minister's having right now with President Trump. And these things will dictate the pace, the agenda, and the priorities that the government will have to face. There'll also be issues that arise that are unpredicted. What comes out of G7, what comes out of perhaps a short or truncated negotiation, if that's what is concluded, or a series of hopefully meetings with the president where the government can deal with tariffs, etc. So these things are going to be, as Marcel has quite nicely laid out for everybody, the remit of the PMO and the PCO as they structure cabinet committees, as they work with the Government House Leader's Office for a legislative agenda. But let's not also forget that the opposition party is also watching what that press conference what the prime minister said in that press conference, because it's a signal to all of these groups. So we'll see how fractious or nation oriented the other parties are going to be in response to Trump. We've already heard from the Bloc as to how they will be supportive of the government for certainly on issues of Trump and trade. So in working with establishing the machinery of government that Dave talked about, the PMO and the PCO, you can think of the PCO as the department for the Prime Minister's office, but also the group that liaises with all other departments in terms of helping them understand when their items will be scheduled, because of course, it's in every department's interest to ensure their minister is prepared, but not only that, to ensure that their items are percolating to the top of the agenda. But much of that has already been set, not just from the mandate and the mandate letters, but from the expectations the Prime Minister's put on the table for at least July 1st. So the next 100+ days are laid out for PCO, PMO, and therefore then departments. So you'll have interactions between a minister's office, and Dave and Jill can tell you more about this than I can, of course, with PMO staff, and then of course, departmental staff at the senior levels with PCO staff. And those things come together in memorandums of cabinet to bring items forward, to get them through, to either lead up and support a budget, lead up and support key initiatives that the Prime Minister and his cabinet will discuss and bring forward. I think we'll still have time to get to sort of some key advice, perhaps, for some of our clients and audience members. So I'll pause there to say that there's also the unexpected, right? As everybody knows, all politics are local, so things will arise. I think Prime Minister Carney has been more active with premiers than perhaps the last mandate was over a couple of mandates. Certainly that's been the anecdotal response, and for reasons, some that Jill has mentioned, but also in reasons of Canada building and a nationwide support to Trump and tariffs. So, those things will develop their own cadence and issues as well that departments will have to be alive to. And then that gets back into the sort of Venn diagram of interactions between PCO, PMO, line departments, and political staff of ministers.
Yeah, so Sad, I'll just add one more thing on all of that, and just how important PCO is to PMO, but also to the government as a whole. And what people often forget is that how important the clerk is, and the clerk PM relationship is super important. And then the clerk also has his or her own cabinet of sorts that every deputy minister, they meet on a weekly basis, and to see what's the temperament of the government and looking at issues across that board. But that relationship, clerk and PM, is critical. I think that the clerk right now, John Hannaford, is there. He's just fairly newly put into place. It should be noted too that Janice Charette, who was the previous clerk, was part of the transition team. So you can see how important that part of clerk and the entire government, the whole machinery is really, I would call PCO being the nerve center of the government.
Thank you. Thanks, Jameson. So getting a little bit more granular and I think a little bit more health focused as well. Just going back to the platform that Jill mentioned. So what impact does the platform of the winning party have on legislation and the priorities that you've all sort of spoken about moving forward? I don't know, Marcel, you want to start with this one?
Yeah, I'll give it a shot. So I think, platforms are really, really important these days. They have been for a number of years. And part of it is, I think there's increasing expectations of accountability. If a party runs on a certain platform, makes a number of commitments, and they're elected, then they need to be accountable for how they are implementing that program. And so for public servants, platforms really important, particularly in the early days, to get a sense of where the government is potentially interested in going, officials pour over the platforms during the election and after to kind of connect the dots between some of the things the government may be saying publicly, what it wrote in the platform, and then what the early indications are from the PM, from the speech from the throne, and so on, about how the pacing of those commitments is going to unfold over the course of the mandate. Now, in the case of the Liberal platform, they have many new commitments across many sectors. You got a snapshot of that earlier on in the webinar. Even in the health sector, which is not one of their major priority areas, there are probably a couple of dozen individual commitments of one kind or another that will need some attention, and that some of them involves significant sums of money. So I will be watching for those early signals of particularly for the big ticket items. Is the bulk of the funding, new funding that the government wants to put in play, is that going to go for the major priorities around the economy, infrastructure and housing, and to what extent will there be anything left over for the second tier of priorities like health? That's going to be really interesting to watch. And of course, the budget will be a key indication of that coming up in June.
Thanks, Marcel. Did you want to add to that?
I would only add that in a majority government, you put certain pieces of legislation in the window that you can slow track, that demonstrate to your stakeholders that, look, we're interested in passing this piece. It's going to go through its due process through the committee. There's other pieces of legislation you can time allocate and move forward in a more quick manner because you control the committee process. Well, that's not effectively the case under this government because it's still technically a minority. We'll see what happens perhaps over the course of the next several months and see how many people want to walk across the floor. But leave that aside. So they're going to have to, negotiate. The committee process can be used to filibuster, slow certain priority initiatives down. And so, we'll see which of those, as I mentioned before, which of those are effectively nation building issues or a response to trade and tariffs, and which will move forward quickly. So we don't know the tenor of the opposition parties yet and how they're going to behave. So, that will also determine not just the priorities, because the priorities will be the priorities of the government, but on how quickly and how effectively Parliament works through the Senate to get legislation passed and to get the initiatives that, again, going back to a very activist Prime Minister, has put on the docket, if you will, and how fast they can get to fruition and to help Canadians.
Mm-hmm.
The only thing I would add is priorities, like as Saad just said, priorities change, and sometimes the priorities always have a dollar amount to that. And as we're seeing now in Canada's, the auto sector is in trouble. So where does a government change the direction that they have with some of their, not priorities, but how they spend their money? And sometimes stuff gets put on hold. You look at, even go back to pharmacare. It was in the 2015, 2019, 2021 Liberal platform, but it took until 2024 to actually get put forward. So things, not that they didn't want to put it on, but sometimes these things do change, and depending on what the priorities of the day. And we always say in politics, a week is an eternity. So that's where things are going to go. Now, that's where we are. We're here to help and to help navigate that. So back to you, Danielle.
Thanks, Dave. Okay, so we have a few minutes left before our question period that we wanted to give everyone. So one big question we wanted to ask and have you guys answer for our clients and people watching are, what advice would you give to organizations operating in the healthcare and life sciences space with everything that we just discussed, especially over the next 100 days to 6 months? So maybe we'll start with you.
Sure. The Prime Minister has cast a different approach to the financial and budgetary and fiscal approach of the government, separating operating from capital in a more deliberate manner. However, the fisc has its limits, and it's already, I think, a deficit in the $50 billion level. So, to me, that's the first sort of thing that's going to guide what the government will and can do, because that will likely grow, even though I think some of the initiatives are baked into that amount. But whatever comes out of the Trump conversations, and let's hope it's positive and goes into a negotiated process, there likely still need to be employee and employer supports, financial supports, trade supports, and shifting 95% of your exports to different markets is not that easy to do. So that takes time, investment, and money. But I think what I would encourage listeners and clients to look at would be the fact that it is an activist agenda. They're going to want to look at certain things. For the first time, we may see premiers have an influence on what that agenda will look like, at least to guide some of that agenda. It could be in health infrastructure, for example, where we know that the government's committed to lean into hospital and long-term care infrastructure for the first time in my recollection. How that plays out and what does that mean? Is it just simply transfers that are dedicated and earmarked? We don't know yet. So I think I would encourage people to look for those sort of things. Build your relationships, get your briefings prepared, seek meetings with senior public servants, political staff once they're known, and of course ministers once they're known. And I also think in transition, details matter. While we may not see a wholesale change in lexicon, for example, like you might if it's a different stripe of government that is elected, but I do think it matters. If there are different structural names for departments, don't get that wrong. I mean, it sounds small. I can tell you I've seen it happen all the time. And use the words that the government is using, those specific words. So if they mean community infrastructure, use community infrastructure. If they want to respect the Canada Health Act and they want to see more public delivery of healthcare, you need to be respectful of that, not to suggest that you wouldn't be. But I think some of those things, while starting to prepare yourself for what's going to be a very fast ride through a whole bunch of different subjects before perhaps they get to the health file, doesn't mean I would be at all sitting back. I would still be looking for these opportunities early and often.
Thanks, Todd. So we have a lot of questions from the audience, but I just want to give Marcel an opportunity to answer that one too, and then we'll move to the audience question.
Okay, very, very quickly. I agree with everything that Saad has said. And I think the key is, there's potential hooks on many issues in the platform. People will have to be patient for the government to kind of get its bearings and, maybe through some of the bigger priority things before perhaps tackling some of the lesser second tier priorities. And when you do approach, government officials, do it strategically. Don't have a list of, 10, 20 things that you want. Make sure it's the top, the top one or two things that the government could deliver on that aligns with their agenda, that aligns with your agenda, and what specifically can be done to move the yardstick on those issues. I think that's where the focus should be.
Thanks, Marcel. Okay, so moving over to some questions. This is a great one and it touches on a topic we actually have not mentioned, but as Health Canada's internal capacity has been increasingly streamlined, how do you see the role and value of pan-Canadian health organizations evolving under a Carney-led administration? Marcel, I might pass that to you because I know you're very familiar with pan-Canadian health organizations.
Yeah, I think that's a really interesting question. If you think about Health Canada, roughly 9,000 employees, about 90% of those folks are working in regulatory related functions, food, drugs, medical devices, chemicals, cosmetics, environment. And maybe about 10%, perhaps even less than that, are working in policy in relation to healthcare. So we're talking, 200-300 people in the policy branch. The Pan-Canadian organizations as a collective, and not to say that, bumps and seats is a measure of everything, but they have, well over 1,000 staff in these organizations if you put them all together. So that represents a pretty significant capacity for Pan-Canadian work that Health Canada alone does not have. So I see the Pan-Canadian organizations as a really, really important vehicle, and not just for the federal agenda. I mean, these are Pan-Canadian organizations. They have representation from the provinces in many cases. And so I think both levels of government really should be looking to these organizations to further some of the key priorities, like work on health human resources, like work on data and connectivity, and like the work on speeding up drug approvals and so on. Those are things that are really priority areas where the PanCans can do a lot to support progress.
Thanks, Marcel. Okay, so one question too, which I might hand over to Jill, actually. So we have a few questions on mental health. I think we touched on that a little bit. But do you have any insight about whether we'll see a Minister of Health and a Minister of Health and Addictions? And I think, Dave, you kind of mentioned this as not necessarily seeing the same ministers that we had before. But can you just speak to the mental health piece, Jill, a little bit?
Absolutely. So I do think through the platform, we are seeing, I hesitate to say it, but a little bit less ambition in the space of mental health and substance use with the Carney government. I think in health overall, there's going to be a little bit less of an emphasis on the file. And with that in mind, I don't think it's likely that we will see separate ministers for health and mental health and addictions. I think it's much more likely that there will be one minister kind of overseeing all of it. Mental health and addictions was kind of a passion area for Prime Minister Trudeau. And I think that came through in trying to ensure that was parsed out and given the special attention. And I don't think we're going to see that same interest from Prime Minister Carney, unfortunately. The commitments through the platform that we did see in this space were mostly just a continuation of programs that were already in place. And so we're not seeing much in the way of work for delivery that will need to be done to warrant kind of a standalone minister.
Okay, thanks, Jill. Another question is, I see health.
Excuse me, Danielle, could I just build on that?
Yeah.
I think I agree with Jill for sure. I think the symbolism that we might all be looking for a dedicated minister in this area is definitely understood. However, since some of the monies have been topped up in the emergency, the ETF, which is effectively monies that will end up in municipalities, I think if you look at the caucus and where they're clustered around major cities and with the addiction issues that exist there, I would hope to see those funds flowing as a transfer payment opportunity. So, perhaps that's not ignoring mental health issues as much as it's perhaps not putting a political leader in the role. Still something to take advantage of with respect to advocacy and opportunities if you're in a mental health organization amongst our audience.
Okay, thank you. And going off of another topic that actually hasn't come up is someone asked, I see health infrastructure investments for hospital, LTC, and clinics, but where is home care as a priority in our healthcare system? We know this was a really big priority for the previous government, but has not really been addressed in this one. So I don't know if Marcel or Jill, you want to speak to this?
Yeah, I mean, maybe just to say that I think it is not as visible for sure for this government as it might have been in the previous government. I think you will have to, in the realm of what the government's talking about for health human resources and support for community-based service delivery and helping doctors set up offices. How to bring the home care piece into the primary care realm, integration of services at the community level and what infrastructure is needed for that to happen. That might be a way to connect the dots.
Absolutely, and I would add there are a few initiatives laid out in the platform targeted at personal support workers specifically, and depending on the jurisdiction from province and territory to province and territory, that can encompass kind of home care workers and folks in that space as well. So while from the infrastructure perspective, it's not as laid out, and there's key advocacy areas there. There are spaces on kind of the health human resources side of things where this space is being taken into consideration and taken into account.
Yeah. Okay, Jill, I know this one's coming right for you, and we anticipated this question. Jill did answer a little bit about pharmacare in the platform, but we have several questions about whether we think this is going to be expanded under this government, and then anything about like a phase 2 that you can address. So I know you touched on it, but happy to confirm.
Yeah, so Prime Minister Carney has indicated an intention to finalize signing deals with provinces and territories. We did not get all 13 kind of done prior to the election being called. However, there has been indication that at this time, there's not an intention to expand it beyond contraception and diabetes. Now, does at this time mean, you know, within the next few years? Does it mean, you know, if he continues on for subsequent parliament, oh my goodness, subsequent sittings, does that kind of bleed into that as well? It's unclear, but I don't think there is an intention within the next few years to expand it beyond that. With that said, the design of the pharmacare program was intended to kind of be a data collection and an information gathering piece as well. And so I'm sure they will be looking at the reports coming back from the provinces and territories on the efficacy of the program, the cost of the program, and making decisions on that when trying to plan out the policy beyond kind of the short to medium term.
Thank you. And I know, Marcel, you might have something to say on that too, as our sort of resident bilateral health agreement expert.
Yeah, maybe just a couple things to add. There's still the remit that was given to the Canada's Drug Agency to support work on lists of of essential medicines. That was in the pharmacare bill. You know, a strategy around bulk purchasing. So I think you can expect the government to still be expecting that guidance back from the CDA. And only on the pharmacare piece, I just observed that the government's already spent a fair bit of the $1.5 billion they had allocated for pharmacare for the bilateral agreements that are in place with the 3 or 4 jurisdictions that have agreements. And that doesn't include Ontario, it doesn't include Quebec. So I don't know whether they've thought about what the financial implications of doing the whole realm of bilateral agreements will be for the whole country, but it seems to me that will be a fiscal pressure that will also be weighing heavily on their mind about how quickly and how fast they can move forward.
Thanks, Marcel. Okay, I think time for one quick one, and then we have to wrap it up as we only have 2 minutes. But we did have a question about health research and how much the government is focusing on health research. It was mentioned in the platform, but if anyone can speak to the role that health research will play in terms of priorities for this government.
I'll just say, I think it'll be a significant priority, not just in the health sector, but beyond that. If you think about where the government was headed before with the capstone agency, that's going to be, hopefully we'll see the contours of that coming out in the not too distant future. Of course, the new sovereignty and resilience and research fund that's going to be stood up. That's going to be a key element as well. And I think, you know, perhaps a play on, you know, making Canada and, you know, more of a leader in research. We already are in many cases, but to really strengthen our position internationally in that area.
And I think I'll just add to that one, because I think anyone in research watching this would want us to say, I think there is opportunity with everything that's happening in the US right now to potentially actually have brain gain, as they're saying. Usually it's the other way around. However, our Canadian system is underinvested in and is not supporting the research, community already. So I think bringing in, American researchers to support in theory sounds great. But I think the key for advocacy, at least on this topic, is to get the Canadian government to improve our system here for Canadian researchers, and then sort of, how do we leverage the American talent that wants to come here. But I think you need to support and focus at home and not just bring people here, because our system already is not really well supporting our researchers. So I think that's it. So thank you everyone for joining us. Just a reminder that we will send out a recording of this webinar if you weren't able to watch the whole thing or would just like to hear our voices again. And then we will also send out the deck with this. And most importantly, I think a survey too that we would really appreciate your feedback on. And then if you do have any questions for us, we have some contact information here if you'd like to reach out to Santis Health. That would be great. We'd love to hear from you. Thanks, everyone.